Hello and welcome to this special presentation of Rajya Sabha television from inside the Parliament House complex. The show is Question Hour. With me is my colleague KRITI MISHRA.
Thank you, Vishal. So let's commence this edition of Question Hour and take our viewers through important questions and the answers.
Well, yes, indeed. Let's begin with the Finance Ministry first, KRITI. And the first question is from Kupendra Reddy, who goes on to ask the government whether it has taken steps to bring back the black money stashed abroad.
Well, the answer is a very comprehensive one. And the government has taken various steps for curbing the black money stashed abroad, which have led to positive results. India has been a leading force in the efforts to forge a multilateral regime for proactive sharing of financial information known as automatic exchange of information. India has also entered into information sharing agreement with the USA under the Foreign Account Tax Compliance Act of the USA. The exchanges have taken place for the financial years 2014, 2015 and 2016. Indian government has been proactively engaging with other foreign governments for exchange of information under double taxation avoidance agreements, tax information exchange agreements, multilateral convention on mutual administrative assistance in tax matters and South Asian Association for Regional Cooperation multilateral agreement. Moving on to the next question, which is one of the questions that was asked on the floor of the House by member Ram Kumar Kashyap of INLD, and he sought information on black money stashed in the Swiss bank accounts from the government. Take a listen.
बैंकों में भारतीयों का बढ़ता काला धन चिंता का विषय है। मोदी जी सरकार के आने के बाद यह विश्वास था कि देशों में काले धन की कमी आएगी। काले धन को समाप्त करने के लिए चरणबद्ध कार्य होगा। सरकारी एजेंसियां कुछ ज़्यादा काम कर पाएंगी। 2014 से लेकर के 2016 तक काले धन में कमी तो आई थी, परंतु स्विस बैंक के हाल ही में जारी आंकड़ों के अनुसार भारतीय नागरिकों का जमा धन जो 2016 के आंकड़ों की तुलना में 2017 में 50% से भी ज़्यादा वृद्धि हो गई है। सर, मैं आपके माध्यम से मंत्री जी जानना चाहता हूं, जो 2017 में अचानक 50% की जो वृद्धि आई है, इसके पीछे क्या कारण है?
Well, the Union Minister Piyush Goyal has answered this question and has informed the House that the money stashed in Swiss accounts has decreased by 80% since the government took over in 2014. Let's listen in detail.
माननीय प्रधानमंत्री जी की सरकार 2014 में आने के बाद एक के बाद एक लगातार काले धन के ऊपर जो प्रहार किया गया इस सरकार द्वारा, उसी के कारण स्विस बैंकों में भी जो पैसा धनराशि रखी थी वो 2014 से 2017 के अंत तक 80% घटी है। ये स्टैटिस्टिक्स पूरे देश के समक्ष है। अब आता हूँ इस स्टैटिस्टिक पे जो माननीय सांसद जी ने अभी रेफर किया। इनका एक स्टैटिस्टिक के ऊपर ध्यान आकर्षित करूंगा। स्विस नेशनल बैंक ने डेटा निकाला कि कुल राशि स्विस बैंकों में विश्व भर में जो होती है उसकी एनालिसिस करके उन्होंने एक डेटा निकाला। हो सकता है वो स्विस बैंक का खाता भारत के कोई ब्रांच में भी हो सकता है वो किधर भी विश्व भर में किधर भी किसी भी भारतीय का हो, चाहे वो भारत में रहता हो चाहे नॉन रेजिडेंट इंडियन हो। अलग अलग प्रकार से ये पैसे स्विस बैंक में कोई भी रखे, वैध अवैध जो भी, वो सब डेटा कंपाइल करके स्विस नेशनल बैंक एक फिगर निकालता है। मैंने स्विस अथॉरिटी से चर्चा की, भाई ये क्या है, व्हाट इज दिस फिगर, तो मुझे लिखित जवाब क्या है और मैं कोट करना चाहूँगा। स्विस नेशनल बैंक का जो फिगर मीडिया में आया है उसके बारे में स्विस अथॉरिटीज़ कहते हैं, The figures published by the SNB, Swiss National Bank, are regularly mentioned in the Indian media as a reliable indicator of the amount of assets held with Swiss financial institutions in respect of Indian residents. Then he clarifies कि कैसे गलत है ये. He says more often than not, the media reports have not taken into account the way the figures have to be interpreted, which has resulted in misleading headlines and analysis. ये सरकारी response है.
Second supplementary. Second supplementary सुनिए.
नहीं, एक ही मिनट सर. Rather, moreover, it is frequently assumed that any assets held by Indian residents are undeclared, so-called black money. फिर उनका कहना है कि अगर आपको सच्ची में इंडियन रेजिडेंट्स का कितना पैसा स्विट्जरलैंड में है वो देखना हो तो एक जो राइट डेटा सोर्स है, स्विस अथॉरिटीज कह रही है, जो करेक्ट डेटा सोर्स है उसको कहते हैं लोकेशनल बैंकिंग स्टैटिस्टिक्स। कि स्विट्जरलैंड, लोकेशन स्विट्जरलैंड में कितना पैसा है ये भी स्विस नेशनल बैंक कलेक्ट करता है इन कोलैबोरेशन विद द बैंक फॉर इंटरनेशनल सेटलमेंट्स। और उस डेटा के अनुसार माननीय सभापति महोदय, उस ये भाई बड़ा इंपॉर्टेंट विषय है, ज्वलंत विषय है, देश में लोगों को इसके बारे में गलत फहमियां दूर करने की सरकार की जिम्मेदारी है। ये खुद स्विस अथॉरिटीज लिखित रूप में देते हैं कि स्विस नेशनल बैंक इन कोलैबोरेशन विद बैंक फॉर इंटरनेशनल सेटलमेंट्स का जो डेटा है वो दर्शाता है कि लोन्स एंड डिपॉजिट्स ऑफ इंडियंस अदर देन बैंक्स, मतलब आरबीआई भी रख सकता है, स्टेट बैंक भी रख सकता है, बैंकों को छोड़ो, जो इंडिविजुअल्स के डिपॉजिट स्विस बैंक्स में है स्विट्जरलैंड में, डिक्रीज्ड बाय 34.5% in the last year compared to the previous year.
Right. Second supplementary.
34% कम हुआ।
Second supplementary.
क्वार्टर में तो 44% कम हुआ।
Union Minister Goel also apprised the House that the automatic exchange of information from the Swiss bank commenced from 2017 to receive financial account information of Indian residents. India will also receive the information of financial accounts held by Indian residents in Switzerland for 2018 and subsequent years on automatic basis. The information received will be utilized to conclude investigations and tax the unaccounted income and assets of the taxpayers and initiate penalty and prosecution proceedings as applicable.
कि 2014 के बाद लगभग 4000 से अधिक हमने इंफॉर्मेशन मांगी है वहां से, और उस डेटा के ऊपर उचित कार्रवाई देश में हो रही है। इसी के साथ साथ अभी हमने जो नई ट्रीटी रीनेगोशिएट की है स्विट्जरलैंड के साथ, उसके तहत 1 जनवरी 2018 के बाद जो भी ट्रांजैक्शन स्विट्जरलैंड में होंगे कोई भी भारतीय नागरिक द्वारा, उसको हमें मांगना भी नहीं पड़ेगा, ऑटोमेटिक डेटा भारत को मिल जाएगा,
राइट,
जिस पे हम कार्रवाई कर सकते हैं। तो ये भी जो 2017 का दिसंबर का डेटा है वो ओपनिंग बैलेंस के रूप में हमें ऑटोमेटिकली सब जानकारी मिल जाएगी।
Here's one important unstart question, Vishal, and Sukhram Singh Yadav, Vishambhar Prasad Nishad and Chaya Verma have asked whether government is completing to take steps to introduce more features in new currency notes after the seizure of counterfeit notes of new currency.
Well, this one has been answered in detail by the government, KRITI, and the concerned minister goes on to answer by saying that incorporating new security features or designs in the banknotes to stay ahead of the counterfeiters is an ongoing process. Now, the security features are strengthened from time to time to enhance the counterfeit resistance of the notes. To check the menace of counterfeiting of banknotes, the Ministry of Finance, Ministry of Home Affairs, Reserve Bank of India, security and intelligence agencies of the centre and states are working in tandem to thwart the illegal activities related to fake Indian currency notes. Well, KRITI, the next question is from the member of the Upper House, Sambhaji Chhatrapati, who goes on to ask the government whether the Benami Transactions Prohibition Amendment Act 2016 could contain illegal transaction of immovable properties.
Vishal, the government goes on to say that Prohibition of Benami Property Transactions Act 1988, as amended by the Benami Transaction Prohibition Amendment Act 2016, seeks to prohibit the Benami transactions irrespective of the method by which the Benami property is acquired. Such Benami transactions include transactions in respect of movable as well as immovable properties. Provisional attachments have been made in more than 1,600 Benami transactions involving Benami properties valued at over 4,300 crore rupees. Moving on to the next question, and this one pertains to the Ministry of Power. And member V. Methrin has asked the steps taken by the government to expedite the establishment of green corridor grid in the country.
Well, this one has been answered in detail by the Power Ministry, KRITI, and the minister concerned goes on to inform the House that green energy corridors, that is GEC, have been planned to facilitate integration of large-scale renewable generation capacity in 8 renewable energy resource-rich states, namely Gujarat, Rajasthan, Andhra Pradesh, Himachal Pradesh, Karnataka, Madhya Pradesh, Tamil Nadu and Maharashtra. It includes strengthening of intrastate and interstate transmission systems and establishment of renewable energy management centers, that is REMCS. Establishment of REMCs under GEC is a central sector scheme sanctioned in 2017-18 at an estimated cost of 409 crore rupees. An amount of 10 lakh rupees and 10 crore have been provisioned in the financial year 2017-18 and 2018-19 respectively. However, no fund has been released so far. The next one, Kriti, is from the member Narendra Kumar Swain, who goes on to ask the government whether it will consider to make the provision of back-end infrastructure cost under Saubhagya scheme.
Well, the government of India has launched Pradhan Mantri Sehaj Bijli Har Ghar Yojana, Saubhagya, with the objective to achieve universal household electrification. Projects have been sanctioned to the states under Deen Dayal Upadhyay Gram Jyoti Yojana, including RE component for strengthening electricity infrastructure for village electrification and distribution system through feeder segregation, creation of substations of adequate capacity together with 33 kV lines distribution, transformers and 11 kV LT lines of adequate capacity in each village. Thus, the scheme provides the necessary back-end system infrastructure for Saubhagya. Saubhagya provides for the last mile connectivity and free electricity connections to all households in rural and all poor households in urban areas. So certainly a very important answer given by the government, Vishal.
Well, yes, indeed. Let's take a short break here.
Lots more on the other side. Stay tuned.
Special edition of Ground Report on Rajya Sabha television from Nimrana.
Many prominent Japanese industrial houses have set up their units in this zone.
More than 50 units have already started working there. This shows that they are very much satisfied in this area.
Restaurants and hotels in Nimrana cater to the Japanese palate.
Japanese living in Nimrana, everybody like.
We are giving the best service as per Japanese requirement.
It will extend its industrial township, advance soft skill development projects to impart training to workers in the manufacturing sectors. It seems that they have made this Nimrana a little Tokyo with a slice of their culture and work.
Watch our ground report, India's Mini Japan, on Rajya Sabha television.
Welcome back. You're watching Question Hour. Vishal, in another supplementary question, Anubhav Mohanty of the BJD asked whether infant mortality rate and mother mortality rate has come down in India.
Sir, after promulgation of the scheme, has the infant mortality rate and the mother mortality rate come down in this country? Which are the states where it has gone up and which are the states where it has come down? Through you, I want to request the minister to kindly specify me the states' names.
Well, Kriti, the minister concerned, that is the Health Minister, JP Nadda, informed the House that MMR, IMR have declined fastest as compared to other countries. Let's listen.
Through this scheme, Government of India, Ministry of Health and Family Welfare, by JSY and JSSK and MA program and PMSMA program, and Lakshya program, I am happy to share with the House that our MMR, our IMR and our under 5 mortality has declined faster than the world pace.
Good.
Number one. Number two, if we talk about the MDGs, according to the 2014-15 records, the decline has been 77%. As far as the global decline is ours is 43%, when India has declined 77%. And if we see that we have declined by 37 points, that is per 100,000, per lakh live births. 167 was the mortality, which is now 130, Are you saying it's percent or point? No, points. 130. This is the decline, and we have attained the position where we have gone far away than the MDG goals. And accordingly, if we go by 2025, we will be able to surpass the SDG goals also, where the target is 2030. As far as the infant mortality rate is concerned, the decline has been from 4,300,000 lives to 39,000 lives.
Well, in a related question, Kriti, Viplav Thakur of the Congress questioned the government over fund allocation of the Janani Suraksha Yojana scheme.
कि जो ये बजट की एलोकेशन करते हैं किस आधार पर करते हैं, क्योंकि जो इन्होंने फिगर्स दिए हैं यहाँ हिमाचल में 2016-15 में 3.10 था और 2017-18 में 2.65 आ गया है. इसी तरह और स्टेट्स में भी कम हुआ है. किस तरह से ये बजट कम कर रहे हैं?
Health Minister JP Nadda said that total envelope of the health budget has been increasing every year. Take a listen.
There is always an increase in the budget, not decrease in the budget. And as far as Himachal is concerned, it was in 2014 2,200 and something, which is now 500 plus. So it is एक program, किसी program में कम हुआ होगा, लेकिन total budget का जो envelope है, that is also always an increase. Number one. Number two, it is the states who say that what fund they need in which head. इसमें उन्होंने फंड इसलिए कम मांगा होगा क्योंकि वहां पर इंस्टीट्यूशनल डिलीवरी ऑन इट्स ओन बढ़ गई होगी, इसलिए वहां पर फंड की जरूरत नहीं होगी और उन्होंने ही कम मांगा है. हमारे तरफ से बजट जब 200 प्लस था, नाउ इट इज 500 प्लस crores.
Another important question was asked by Kumari Shelja, and she asked whether the government has conducted any study on the rise in the incidence of lifestyle diseases in the country.
Well, the Health Ministry responded to this question by informing the House that Indian Council of Medical Research, that is ICMR, and other institutes conduct studies on lifestyle disease. According to ICMR, India State Level Disease Burden Study Report, India Health of the nation states the estimated proportion of all deaths due to non-communicable diseases, that is NCDs, has increased from 37.09% in 1990 to 61.8% in 2016. As per the National Family Health Survey, NFHS, 2015-16, 11% of women, that is 1 in 10, and 15% of men, that is 1 in 7, of age 15 to 49, are hypertensive. The survey has also found that about 60.4% of persons screened have never had their blood pressure measured. The government has formulated the National Health Policy 2017, which aims at attainment of the highest possible level of good health and well-being for all at all ages through a preventive and promotive healthcare orientation in all the developmental policies and universal access to good quality healthcare services without anyone having to face financial hardship as a consequence. The next one, Kriti, is from the member, Shri T. Ratnivel, who goes on to ask the government whether it is a fact that government has in February 2017 rolled out a massive free door-to-door screening program for early detection of cancer, heart disorders and diabetes, which amount for over 35% of all the deaths in India.
Well, the answer is an affirmative, and the answer is a very comprehensive one, Vishal, and the government goes on to say that a population-level initiative of prevention, control and screening of common non-communicable diseases like diabetes, hypertension and cancer like oral, breast and cervical cancer has been rolled out in 2017-18 under National Health Mission as a part of comprehensive primary health care. Under this initiative, frontline health workers, such as accredited social health activists and auxiliary nurse midwives, are leveraged to carry out screening and generate awareness about the risk factors among the masses. This initiative will not only help in early diagnosis, but will generate awareness on risk factors of the diseases. The initiative has been rolled out in over 150 districts across the country, and as informed by state governments, about 72 lakh people have been screened for non-communicable diseases under population-level screening. So that's a very important answer, Vishal.
Well, yes, indeed, it is, Kriti.
And moving on to the next question, this one is the oral question asked on the floor of the House, and member P. Bhattacharya asked the Health Minister the number of people who will be covered under government's Ayushman Bharat scheme.
The Minister has said the government announced the Ayushman Bharat in budget 2018-19. The Ayushman Bharat consists of two components. One, provision of the comprehensive primary health care, and another through health and wellness center. And number two, Ayushman Bharat National Health Protection Mission. But my question was specifically I wanted to know how many people are being covered under this scheme.
The minister concerned, Health Minister J.P. Nadda, replied to this question in the House in detail. Let's listen into his reply.
According to the socio-economic caste census, 10 crore 74 lakh people are covered under the SCCC data. Approximately 50 to 55 crore people are coming into this program. This is entitled-based program, and this covers the full family, whatever the size of the family may be. And 5 lakh rupees per year will be given as the health coverage for this procedure. In the month of February, we had the state consultations, and consultations were done extensively with all states, because many states were running with their own health schemes also, and protection schemes and insurance schemes. So whether they wanted to subsume or they wanted to go separately, that consultation was done. Out of 26 states, MOU has been done. And now the empanelment process is on. And there are 1,350 secondary and tertiary procedures which have been enrolled in it. The package is according to the empanelment, and that has been shared with the states.
Right.
The IT platform is being developed. By July end, the data testing is going on. The beneficiaries have been identified. 80% in the rural area, 60%
Minister.
in the urban area.
Second supplementary.
Yes, I have a serious supplementary, that is, all these things, Ayushman Bharat, that confine particularly in the urban areas, in the urban hospitals and the other areas, it has given some result, is no doubt. But I like to know, in the rural areas, exactly it has not yet been done anything.
What about rural areas? Please, rural areas, please.
Procedures are done in hospital. All government institutions are deemed to be impaneled. So all government institutions will be doing it. And in 2-tier and 3-tier cities, wherever there will be facilities, we are impaneling those institutions and we'll be supporting them.
Another question, Kriti, came in from the Upper House member Kanimoy, who asked the minister how the government will support the states which are already running an insurance scheme.
Some states like Tamil Nadu have all implemented this national health protection scheme. So I'd like to know how the government will support such states, because we've already invested in the insurance of its people.
Here's a detailed answer given by the Health Minister on the floor of the House.
Every state we had a consultation. They have their own insurance program, but there are left outs also. We have got our own programs. There is some duplication also. We are going to give support to the SCCC data the beneficiaries. And whoever comes, they are coming out with the program where they are going to take out the SCCC data, and they will be supported by us.
Moving on to the Ministry of Minority Affairs now, and Kapil Sibal asked the government about the details of the offices which are looking after the facilities provided under Pradhan Mantri Jan Vikas Karyakram.
Well, the details of the program have been given by the concerned minister here in his answer, and he goes on to say that Pradhan Mantri Jan Vikas Karyakram, that is PMJVK, is a centrally sponsored scheme and is implemented by the state governments and Union Territory Administration, central government departments, organizations, CPSEs, etc. through the existing machinery. Under the program, the state government, UT administration, central government departments, organizations including CPSEs, undertakings, central, state universities, etc. assign the work to a suitable department or construction agency as per the practice. There is no provision for appointment of government officers for implementation under the program. The PMJVK has been recently implemented with effect from May 2018. Well, the last one, Kriti, for this particular episode is from Dr. Vinay P. Sahasrabuddhe, who goes on to ask the government whether, as a whole, it has completed any data about new and innovative schemes and programs implemented for welfare of minorities during 2014-18 and their success so far.
Vishal, here's a very elaborate answer. So the government has undertaken multimedia campaign to spread awareness of welfare schemes meant for minorities through print and electronic media, namely Doordarshan Network, All India Radio Network, including FM channels, private FM channels, private TV channels and websites all over the country, including rural and far-flung areas. Pocket booklets and pamphlets on various schemes, programs of the ministry are published in Hindi, English, Urdu and other regional languages. In order to directly reach out to the public and spread awareness, Progress Panchayats are organized in various places. Regional coordination and review conferences are also held with state governments from time to time, where information about ministry schemes is provided. In addition, outdoor publicity is also being done by organizing Hunar Haat. So these were the important questions and the answers given by the government during the previous monsoon session.
We'll come back again next week with some more questions and some more answers.
Thank you for watching Rajya Sabha Television. Stay tuned.